So welcome to the last session of the Front Range Biological Safety Association's 2020 Symposium. This session is called Lessons Learned Being Prepared for the Next Pandemic. It seems fitting that during these times and the first day of ABS International Biosafety Month and the first day of October, which is my most favorite day of the year, that we're going to share some things that we've learned about biosafety and security, things that we've worked through the last 9 months, things that we've triumphed through during this pandemic. This session is going to be a little bit different from the others because we want everybody on the call to participate. The 3 questions included what unique project you've worked on in 2020 that you never thought you would be working on as a biosafety, biosecurity professional? How has your job changed during the pandemic? Or what is the most unique problem that you've had to solve during 2020? So those are some of the questions we put out there. I would encourage everybody to think about how you would like to share. Let's get started. The first person up is Mike Burt, who's the Vice President at Air Filter Solutions. And the question he chose was, how has your job changed as a result of the COVID-19 pandemic?
Thank you. Good afternoon, everybody. Can you hear me?
We can.
Okay, yes. Good. So I think what's changed mostly for us is the awareness of air filtration. ASHRAE had made us kind of our guideline in our industry. ASHRAE had made a statement that minimum filter efficiencies that should be used for most buildings is a MERV 13. And while that's a higher level of air filtration in buildings and facilities in general, it's not what the industry was prepared for. So there was a huge supply and demand problem. And so products started diminishing. That was number one. And then number two, what happened through that was, as it turns out, PPE products are manufactured with the same air filtration, some of the same air filtration medias. So PPE got first choice over air filtration, which has left the manufacturers in a shortage of air filtration. So it's kind of forced us to get with some of our better customers, significant customers, whether it be clean room, clean spaces, BO3 research facilities like CSU or University of Wyoming or CU Boulder. We've had to give everybody heads up that there's long lead times, and so we've had to replan how we go about doing business, and there's been a tremendous amount of communication, picking up the phone and calling customer base and prospective customer base, whether it be a school district or, like I said, universities, and giving them heads up. Don't expect to get this in 1 week or 2 weeks, but rather it could be 4, 6, 8, 10, and 12 weeks. Mm-hmm. And that's a long time to wait for product if the owner anticipated to change filtration at a much earlier stage.
Got it. Yeah, I could see where that could be a challenge right now. Has there been any unique request from a particular client to come in and do air filter that you wouldn't normally have service?
I think from that standpoint, the best way to answer that is the consumer that was more along the lines of reactive and expected to get filters right away, right, had no idea what was going on. So while the vast majority of our customer base we've kept on top of, they were able to plan. The consumer that was reactive was caught with, oh my God, how am I going to get this product? And now they're scrambling. And those are the ones that were most significant that I think of.
Oh, well, thank you very much, Mike. Appreciate your insight. Cindy's our second contributor here. She is a hazmat specialist and a Wi-Fi webinar guru at the University of Colorado Springs. And her question was, describe a project in which you were involved in or a task that you were asked to complete in 2020 that you had previously not associated with biosafety or biosecurity?
Okay, so one of the tasks that I got tagged with was to be a part of our recovery teams on the logistics team. And somehow that made me be in charge of social distancing. And so over the time frame, I became the lead on resetting every classroom on campus for social distancing. So somehow that made me into the expert on how to relay out rooms to meet social distancing, which is not something that I really ever thought would be in the biosafety, necessarily within my biosafety hat. So between that and now I am also having to review, I review all the IBC applications on campus, but now I'm also reviewing all the IRB applications on campus as people are starting to restart face-to-face research. And so now we have a safety plan that they have to develop, and I have to review all of those to make sure that they're utilizing all the appropriate social distancing, there was proper decontamination, all of the things associated that normally we wouldn't have thought about with IRB-related research. So those are kind of the two things that I've managed to pick up into my arena that were not part of what I would have normally thought would be in my house.
I bet you're really good at that 6 feet estimation distance now.
I am super great at 6 feet. I am super great at 6 feet. And I am really creative in the way to move furniture in a room to get the maximum number of students in a room. Super creative.
Well, thank you very much, Cindy. That's definitely something I wouldn't have expected as a biosafety professional. Our third contributor is Claudia Gentry-Weeks. She's an associate professor at Colorado State University. Her question is, describe the most unique problem that you had to address in 2020. And she was at, oh, there she is. She's here. Good.
I'm here. Can you hear me?
I can. We can.
Okay, great. Let's see, there's so many of them now. I guess a lot of it was just planning. Didn't realize how difficult it is to actually train people in laboratories, in the laboratory setting, when you're supposed to stay socially distanced from them, and thinking about things like a microscope usage and making sure that you can trace back who's been using what in the classroom. Those have been really challenging issues. We basically capped our classes, and we had a biosafety committee in our department that was composed of some of the teaching faculty, and we did most of the work ourselves because, we're a big campus. There were a lot of people working, simultaneously, and it was really a huge effort. But we were a little bit concerned that, whether we wanted to be able to, we knew about the science, right? So we could look at things, and we decided to sort of take charge ourselves and just do the work, like taping off the areas and assigning seatings. We had seating charts made. How we're going to reduce movement through the lab, so the students only stay in their location in the laboratory, and we bring all the materials to them and pick them up and still stay 6 feet apart. And then trying to teach them the lab, of course, it's been very difficult because you need to sort of see their work, so it's hard to show somebody how to, or talk them through. I've become very good at talking them through how to use a microscope from a 6 feet.
Oh, right.
So, and do a good job and be able to take pictures with it and stuff like that. So it's been really interesting in that way. And also finding great, we never knew when we were going to go online. So we had we built an online course. Each of us had to build an online course and an in-person course. And we as a department, or our group, our teaching faculty group, decided that we would front load all of our really tough experiments, heavy pipetting, things like that would go in as soon as possible. So after we thought, we kind of had some bets going on about how long we'd stay in classes. So we've done better than we thought. And we were thinking if we could get past the 4-week mark, they would at least know how to do all the pipetting serial deletions. We could streak out bacteria, those practical things that you need to know that the simulations out there are just not quite good enough for, to do that.
Right. Well, that's certainly a challenge, trying to teach pipetting by video for sure.
We did make videos of everything that we do. So we have this giant pile of videos.
That sounds great, Claudia. Thank you so much for contributing. Our fourth speaker is Tony Sambol, an Associate Biosafety Officer in the Office of Regulatory Affairs, Department of Pathology and Microbiology at NPHL. Tony's question was number 2. Well, you don't know which question. His question was, describe a project in which you were involved in or a task that you were able to complete in 2020 that you had previously not associated with biosafety or biosecurity.
So I've been at university for 20 years, Associate Biosafety Officer. A lot of good presentations today about people working in BSO2 and BSO3 labs and everything that's needed to go along with that. I have been involved with training people to work in BSO2 and BSO3 in these types of settings. We have just a small handful of PIs, not unlike some of the other areas. So the challenge that, or the unusual thing that I was tasked to do along with another person this year was to go out, this was probably around Easter time, to go out and work with our Army National Guards in helping them set up collection site facilities around the state of Nebraska. You've all seen these on the news now, very common drive-through specimen collection devices. And they had procedures in place, but they really weren't sure what was needed to be done for, sending the specimens to the laboratory. Exactly, we worked on the biosafety part. How do you take the specimen? How do you label the specimen? Everything that's involved, how do you package the specimen? What kind of rosters do you need or manifests? So there's a lot of biosafety going on with that. They had no labeling systems for a while. We had problems with, just like today I'm using my cell phone, we had to use cell phones for hotspots because we had an off-site order entry system. And then once the specimens, again, were collected, how did we package them? And the biosecurity, how did we get them back to, say, the university or wherever they were going for to be testing? So a lot of things I never thought I'd be doing, outside of a formal BSO2 or BSO3 lab.
Right. Yeah, training non-scientists on biosafety is probably a challenge too.
Yeah. And I will say that the guard teams, and probably in every state, they were fairly well equipped. I know that a lot of the sections of the guard teams are medical people.
Okay.
But, as far as orientating them to how to do it, safely so that when we got the specimens back in the laboratory, the process, I think, was something they really did.
Right. Something new for them too, huh?
Yes.
Thank you so much, Tony, for your contribution. Our fifth contributor is Jen Weingart. She's the Senior Manager of EH&S at AVEX, Colorado. I hope I said that right, Jen. Let me know if I didn't. Her question was, how has your job changed as a result of the COVID-19 pandemic? Speaker is Denise Merrill. She's the Biocontainment Manager at the Wyoming State Veterinary Laboratory. And her question was, how has your job changed as a result of the COVID-19 pandemic?
Hi, everybody. My day-to-day job actually didn't change greatly because in Wyoming, wildlife, human life, and health of livestock is about on an equal footing. So many of us continued to work every single day since March when the main university campus closed down. Working at the Wyoming State Vet Lab means that we had to continue normal day-to-day testing. We had samples that were shipped to us every single day and had to be tested, so that couldn't stop. We had to approach it in a way that our technicians came into the lab, got their testing completed, and headed home and remained on call. And if more samples needed to be processed, then they had to come back into the lab. If we had labs, and we do, our serology labs in particular, had to split their staffs into two different groups. So in the morning, a couple of individuals would come in and they would take on the testing, and they would go home, and they would not overlap with the second shift. That way, if there was any chance that anybody tested positive, the entire section didn't close down. Very important for our laboratory. I have worked every single day. I have not taken one day off, being the head of the security, and also I became the head of the face covering grump society, as I had to make sure that people continued to wear their face covering over their nose and their mouth, because even though we work in a laboratory, people would think I can just wander down the hall without a face covering on my nose. And some people weren't real happy about that, but also just making sure people were wearing a face covering, because it is required on all University of Wyoming property to have some kind of a face covering. I'm also a member of our 4-person COVID action team. Because we are not located on the main campus of UW, we had to put into place a few different practices than main campus, because they went to almost virtual everything while we maintained our entire staff here. We had to put into place different kinds of travel restrictions to maintain, if we went to Colorado, we had to say we were going to Colorado because it was out of state. Right. And that could have put us in jeopardy. I also became a little bit of a resource just because of my background working in infectious disease for 30 years and being the biocontainment manager here at the vet lab. Working with our biosafety specialist, we have been asked to give a little bit of input for biosafety, which is nice, for our upcoming COVID testing that we're taking over to do in-house for the entire campus. And so we've been able to share biosafety practices and some kind of training programs that could be put into place, which is, outside of our norm, but not really. We're biosafety. We will answer any question and offer any training as possible.
Well, I've noticed one theme today. Everybody needs a vacation. Sounds like everybody's been working long and hard, including you, Denise, and I hope that everybody gets well-deserved time off soon. Thank you for that contribution. Jen, yes, your question was, how has your job changed as a result of the pandemic?
So my name's Jen Wingard, but you're allowed to mispronounce it because it's my married name. That's all right. And it's Avexis, Colorado. We are part of Novartis Gene Therapies, and we make Zolgensma, which is a gene therapy for babies born with SMA that you might know about. It's pretty exciting. We've affected a lot of great families and saved babies, and that's what we get up and do every day. We get up to save babies every day, so we have a happy, healthy workforce. We run 24/7 GMP making drug substance. So Jared Pola said we were a critical employer. We never closed. We sent half of us home, right? I'm at home now. I met Dr. Fauci here in my home. I think it was even a FRAPSA meeting. It might have been a different NAM meeting or something. But he's been in my house. I should have done a selfie with him. How has my job changed the most because of COVID? I have become the queen of COVID. So we were predicting that it was going to hit the U.S. in January, February. We were hoping it was going to be like H1N1. I've been through that before, done lots of pandemic planning, business continuity. How are we going to keep making Zolgensma and save these babies? It's been trying. Many of our operations are small scale. What we do now is we use this Paul Icelis equipment. One machine replaces an entire roller bottle facility. We use human kidney cell lines and a viral vector to make this product. These people have to be close together. wearing masks constantly, always concerned now, especially that we're going to actually take a whole team down because of the quarantine, not because everybody gets sick. So we're actually talking about PAPRs again and N95s again, and it's been rough. My favorite part of my job, though, is that all the other EH and S that I did is now COVID. I teach COVID classes every week. I have onboarded over 60 new hires, so we never stopped hiring. I have onboarded so many contractors. I've had to have the come to Jesus meetings with contractors and said, I don't care about your politics. We're a science-based, compliance-based business. You have to follow my rules on our site. Most of these rules, you guys all know, they're not new. We call them the 5 golden rules about, stay home when you're sick, wear the mask, distance, wash your hands, cleanliness matters. All of those rules are in the book that I use when I teach. I don't know if you can see this, but I found this when I redid my office. It was written in 1919. It was from my grandpa. It's called Epidemics, How to Meet Them. Teaches you how to make a mask, teaches you how to wear a mask. People complained about it back then, too. They partied in the streets, they wanted to send people to jail. So I try to bring humor into it. We will get through it together, but I think it's been actually kind of fun. One of Jared Poulos' best things that he did for me was telling people that you can't come to work when you're sick. I wish we always had it that way, right? The travel authorization stuff's been killing me too, really for sure. The work from home is also a new frontier, and luckily I have a person now that just got assigned to me, and she's going to manage all my work from home ergonomics program. We really upped that. We added money to people's paychecks to help pay for some of the stuff to make sure we're not hurting and working at home. The complacency part is what's hurting me right now at work even. People are freaked out by the election, by the homeschooling, by the schools reopening, by the holidays, by things getting cold again. Ventilation matters, and I want to know why no one's talking about ventilation on the news. And I'm really concerned for us. I don't go in restaurants. Arizona's going to get healthier because now they can open their doors and sit on patios, right? But we're not going to be doing that. So what's next for my workers? One big thing that has changed, I think, for all of us as EHS professionals is that now we're allowed to talk about people's behaviors outside of work because it's a pandemic and it's a protection of all workers, grocery store workers, restaurant workers. And when I teach that, and I say we have to protect all of them. And your risky behaviors outside of work could take me down at work. If I take down the whole upstream cell expansion group, we're not making Zolgensma, right? It's gonna be a bad thing. So I think my employees really are lovely and they're funny and they're smart, thankfully, and they get it. And we haven't had too many problems. I think we've had 4 positives on our site. We have 409 employees. They're not all there. We have about 260 contractors, not all there. So 4 cases since March 16th when we all went down, I think is pretty good, and it didn't spread. And the people are still healthy. They never got hospitalized. So it's been a big learning thing for me, and I've really enjoyed listening to all of you. I think this last session here is actually teaching me the most. I wrote down all your names, so I'm going to be emailing all of you because it sounds like you're going to have some good information.
Yeah.
Thank you all.
Yeah, thank you so much for contributing, Jen. Really appreciate it. Now it's open, and I'd like other people to share their lessons learned, their highs, their lows. How big
of a problem do you now have continuing with the changes due to COVID and filters not being able to keep up with the forest fire smoke?
That's to top it off. If COVID wasn't enough to increase the amount of sales for air filtration products, then all of a sudden forest fires come into play, and that's like paste. That's like putting paste on air filters. And so that doesn't even include the idea of odor. So some customers came to us saying, we've got to replace filters because our filters are caked up with ash. And others came back and said, what do we do to get rid of the odor? So it would be with some form of carbon filtration. And again, supply and demand, that is the biggest concern. And while we would have been proactive to bring in a lot of product to be able to take care of our customer base, that was off the charts. And it still is right now.
Oh, I can only imagine. We did not need that to happen on top of COVID.
Yep, exactly. And then California, they just pretty much called straight up across the United States and said, we'll take every carbon filter you have. So, and they called up every distributor, every manufacturer. So, California's, in and of itself is terrible, but now, you take Colorado and Wyoming, it's been a difficult situation to try to help our customer base out.
I can start calling on people. Denise has something she'd like to share.
I think lessons learned for me were, in terms of COVID supplies, whether it was to support research needs, then as we started ramping up and having even some staff return, but even just within environmental health and safety, our own needs, the COVID supplies, of course, obtaining those are a real challenge, right? And I found that establishing relationships, for me, I went to the source. That's where I would start. So if I needed spray bottles, I didn't start looking at Grainger and Fisher and Staples and Home Depot. I went to the manufacturer distributor who would supply spray bottles to those entities. And I just started with the largest manufacturer and distributor. And of course, as a medical campus, doing research on COVID early on, I certainly mentioned that up front in my conversation. And I think early on in, the month of April and May, they really took pity on me and our circumstances and were more than happy to help. We weren't buying container loads of spray bottles. We were buying cases, but they were still more than happy to help. And I still reach out to those contacts that I established early on, and when they can help us, they do. So that was really a lesson learned for me, was don't hesitate to go to the top of the food chain, because this was April, May, and by the time we rolled around to June, July, what I thought was a scorched earth time early on was nothing in comparison to when businesses started opening around the world, right? So initially we were competing with other universities' needs and hospitals and clinics. And then, once we rolled around June into July, the competition was global. So that was one thing that I learned. I think also, acquiring, if you don't already have it, de-escalation skills. And I think some of you have touched on that. Everybody can be in a different place, in a different comfort level around this pandemic. And we can all approach it, quite differently when, say, masks are required. So, if there's an opportunity to acquire or hone your de-escalation skills, I think that's also been very helpful as well. Everybody's stretched, I think, to their emotional brink and mental brink, and so wound a little bit tight, I guess. So that's what I have to contribute.
Oh, Zach came on. It looks like Zach has something to share.
Sure, yeah. So one of our undergraduate microbiology lab instructors at the Denver campus contacted us about how to best do a at-home microbiology kit for the undergrad labs. So we worked with them to do a biosafety level 1, risk group 1 aseptic technique project that they could do at home. And actually, so that was interesting, something we wouldn't usually do, but made sure that the transport and disposal of everything was going to be safe, and kind of how they should do that. And then also, like, told the instructor, like, this would be a great time to talk more about biosafety and biosafety levels, and maybe you have a question where it's like, how are you turning your space at your house into BSL 1 compliant space? And which, talking about it now reminds me I should touch base and see how all that is going. But that was an interesting project to think about.
Absolutely. Thank you. I would like to echo Denise, not only on the de-escalation skills, but I have noticed that regardless of politics, institutes that I've been working with, those that have really good leadership are the ones that have succeeded in getting, I've been personally working with a lot of campuses to get their students back in the dorms and back into the classrooms, and those that have good leadership are the ones that have succeeded in keeping their kids in class. So, if you can grab leadership skills too, that would be a fantastic skill to have in a pandemic. Are there others that would like to share? While we're waiting for the next person to appear on the screen to share, I would also recommend one of the things that I found most valuable during this pandemic, and I know we've practiced this along for decades, is just running drills, right? Running your spill drills. But the tabletop exercises that we've done around getting kids on campus and what happens if a dorm gets sick or an athletic team gets sick, practicing those and running drills on that, and tabletops has really been invaluable for a lot of the universities. See, Denise Merrill's back on here.
Hi. I have one little thing to say. The one thing that nobody has touched on is that as biosafety professionals, many of us have also been trying to provide reasonable information to family and friends. It's not just a work thing. It's how can we use our expertise to help keep our family and friends and extended family, not people who even live close to us, safe from infection. So that's an added stress, I think, that probably everybody in the field feels, because we have an expertise that they don't have. I mean, my sister works in a school. My other sister works for an Ivy League school, and so that's a huge thing that our society, our profession does. And I think people don't expect a thank you, but I think the expertise that everybody has, I reach out and say thank you for giving me some of your input. It has helped me provide resources to my family as well.
Absolutely. And we've probably all been asked a ton of questions on social media from family and friends, which can really take a toll on somebody. So absolutely, we all should be really proud of what we've been doing the last 9 months, getting through this and leaning on each other and our expertise around biosafety and security.
So, Lolly, I have a question to throw out there so that maybe somebody who's attending wants to provide some input on. And then while we're waiting for people to do that, Claudia has something else to add. But the question is, does anybody have any more information about eyes and COVID? So if there's anybody in attendance who has some more information about eyes and COVID, we'd like to hear from you. And in the meantime, Claudia has something to share.
Oh. I just put that up because I just got a message from somebody from JAMA. They just published something on ophthalmology and COVID, and we have been hearing that people are getting transmissions from the airborne COVID into eyes. So I just wondered if any of you folks had heard more about it.
Absolutely. If anybody knows something, let Cindy know so you can contribute.
And then Claudia has something else to contribute here.
I just wanted to say, I think probably a lot of people, to add on to the person that was speaking, that like people have asked, we are here. I'm not even talking right today. Sorry. As professionals, it's getting me. I think we can help businesses and churches and things, groups like that probably need some guidance if they request it. Like I've been requested to, and I made a video from my home to encourage people about wearing masks. And then there are a lot of people who want to go back and do things like meet at churches and things like that. And I think it's good to remind them of, the risk and things that they can do to mitigate that, and that social distancing is a good idea, and maybe we can just be a little bit more patient.
Agreed. Absolutely. There's a great resource on the ABSA International website about giving kind of a step-by-step guide to communities that are holding events that need some extra guidance. So that's a good place to start. But yes, reaching out and letting others know how, giving your expertise is a great way, Claudia. Thank you.
And I actually put out and told people that if they wanted me to come and talk to them, I would be glad to come and just talk to them about it, because that we can all kind of do our part. And I mean, like, we have a lot of time, but I think it's a good, worthwhile thing to do. And I get really concerned when I go to places. If I go to places, I haven't gone anywhere, so I don't know why I'm saying this. But when I have gone to like pick up some food and things like that, if I see somebody, it's you want to help the businesses because they're having to survive, and it's at hard times. So
right.
I need that info.
Absolutely.